There are times that you don't feel comfortable passing stools, and the food that you eat takes several days to exit your body. Some people pass stools several times a day, while the others might have them only once or twice a week. Whatever your bowel movement pattern is, it is normal and unique for you, as long as you don't stray too far from your pattern. So, how should you know if you are constipated or not? And if you are, what should you do about it? Hello and welcome back to our channel. This is Dr. Fatima, and today we are going to talk about the causes of constipation and its treatments. So if you're interested, please stay tuned. Constipation is generally described as having less than 3 times bowel movements a week. But it's still possible that you only pass stool once or twice a week, but you're okay with it and you're comfortable while passing stool. So we mostly consider you constipated when your bowel movements results in passing dry and hard stool, and it's kind of painful. Constipation happens when your large intestine or your colon absorbs too much water from your stool. So normally when the food that you eat passes through your colon, it is your colon's job to absorb some water from the food and produces stool and forms it. When the contractions of your colon's muscles become too slow or sluggish, then the stool would stay in your colon for a longer time, resulting in too much water being absorbed from it. So what can cause this situation? What is the reason that these contractions get slow? Well, there are a lot of different causes for constipation, and one of the most common causes is medications such as iron supplements and antidepressants. Some other common causes of constipation include lack of exercise, having not enough liquid, not enough fiber in your diet, changes in habits or lifestyles such as travel, pregnancy, and having a lot of stress in your life, and old age. So now that we know a little bit about the most common causes of constipation, before jumping to the treatment, let's talk about 5 most common symptoms of constipation so that you can make sure if you are constipated or not. The 5 most common symptoms of constipation include difficult and painful bowel movements less than 3 times a week, feeling bloated or uncomfortable, and abdominal pain. Okay, now for the treatment, the first step is self-care, because the good news is that the most cases of mild to moderate constipation can be managed by yourself at home. Self-care starts with taking an inventory of what you eat and drink, and then start to make changes. So what you should do is to add as much as possible fruits such as citrus fruits, vegetables, whole grains, and other high fiber foods into your diet. And try to avoid high fat foods such as meat, egg, cheese, fast foods, fried food, and alcohol. You can also keep a food diary and single out the foods that makes you constipated. In addition to the foods that you eat, moving and doing exercises can be a great help for your constipation. Now I'm going to teach you 3 yoga poses that can help you with your constipation. The first pose is child's pose. So you should start with sitting on the floor with your knees being apart a little bit more than your hip distance. Your feet should be tucked under you and your big toes must touch. Lean forward and place your hands in front of you. Creep forward until your forehead is touching the mat. Hold this position while breathing deeply. The second pose is wind relieving pose, which is a great non-twisting pose for relieving gas. For this pose, you should recline on your back and hug your legs into your chest, or you can extend one leg out. Hold for a minute or 2 and then switch. The third pose is Matriasana twist, which is a seated twist that can stimulate your digestive organs and is really helpful for your constipation. For doing this pose, begin in a seated position. Bend your left leg and place your left foot on the ground over your right knee. Bend your right knee and tuck your right foot near your butt. Place your right elbow near your left knee and twist your body, looking over your left shoulder. Hold and then switch sides. You can also use some juices for your constipation. Drinking some certain juices can help relieve your constipation. Juices made of fruits and vegetables include dietary fibers and sorbitol, both of which are really important in regulating your bowel movements. Juices also include large quantities of water, which can help soften your stool as well as keeping you hydrated. Fruits and vegetables have two types of dietary fibers, both of which are really important and helpful in keeping your regular bowel movements. The first one is soluble fiber, which absorbs water. So basically, when you have a lot of soluble fiber in your stool, it absorbs water into your stool and makes it more soft and flexible. Some sources of soluble fiber include oatmeal, beans, fruits, vegetables, psyllium, seeds, and nuts. Insoluble fiber, on the other hand, does not absorb water, but it helps the waste material to move through the bowel. Insoluble fiber also flushes out the bad bacteria from our gut. You can find insoluble fiber in bran, whole wheat, rye, nuts, seeds, and fruit and vegetable skins. Another important thing that some fruits contain is sorbitol. Sorbitol is a sugar alcohol which can pull the water into your large intestine, resulting in loosening your stool and helping your digestive tract. The fruit that contains sorbitol include apples, pears, grapes, plums, peaches, and apricots, dried fruits such as prunes and dates. Now about prunes, there was this systematic review article that showed that the patients who took about 100 grams of prunes per day showed better results and better stool consistency compared to the ones who took psyllium, which is a soluble fiber and a laxative. Prunes are high in dietary fibers, but much of these dietary fibers are lost in the juice processing level. However, prune juice still acts as a laxative because it includes potassium, magnesium, and sorbitol, all of which are really important for our digestive function. So how can we make prune juice? In order to make prune juice, you're gonna need 300 grams of prune and 2 liters of water. So you should fill a pot with 1 liter of water, add 150 grams of prunes to the pot, and heat the pot. Once boiling, reduce to low heat, cover it with a lid, and let it simmer for about 2 minutes. Then pour the prunes and the water into a blender and blend it until it is smooth. Your prune juice is ready and you can put it in the bottles and keep it in the refrigerator. In cases where your constipation doesn't get any better with these home treatments and it's lasting too long, you should visit a doctor. In 2019, there was the systematic review which introduced a few steps that your doctor might take based on your condition. So after medical treatment, in case you don't respond to the medical treatment, your doctor might ask for some other tests such as manometry or defecography. There are also some red flags that in case you have them, you should definitely visit your doctor. These red flags include acute abdominal pain, nausea and vomiting, weight loss, melena, rectal bleeding, and fever. So make sure that you visit your doctor in case you have any of these red flags. That was it for today. Thank you guys for watching, and please don't forget to like, share, and subscribe. And also, if you have any medical problem that you think I can help you with, just leave a comment below and I'll try to get to it as soon as possible. Bye!